Hello guys, welcome to our channel PKR Vibes Career and Growth. First of all, thank you so much for your time to spending here to learn something new today. Today we will discuss about revenue codes in medical billing, or we all of you know that the medical billing claim forms on UB4 claim form. Generally we will use revenue codes instead of place of services, and we have to understand that this UB4 claim form is also known as a CMS 1450 claim form. This UB4 claim form is using for hospital buildings or institutional buildings. Why? Because the institutionals, for example, the nursing home facilities, rural health clinics, rehabilitation centers, some chronic dialysis centers, and some other healthcare facilities are using this medical UB4 claim form. That is why it is known as an institutional claim form or institutional billing. And we all of you know that this UB4 is developed by Centers for Medicare and Medicaid Services and approved by National Uniform Billing Committee. And this UB4 claim form is maintained by National Uniform Claim Committee NUCC, and the medical procedure code set, nothing but whatever the treatment is given by the doctor to the patient, that procedure code set is maintained by American Medical Association. And we all of you know that CMS 1500 claim form is known as a physician billing. So that physician billing having 33 boxes, but here UB4 claim form have 81 boxes. Generally we can call it like a field locator or form locators. So there are a 81 field available on UB4 claim form. So we have to understand that the CMS 1500 claim form, I mean physician billing or professional billing claim form, is that claim form having CPT codes, and that CPT codes are associated with respective place of services. But coming to here, UB4 claim form having Hcpc codes, generally we can see like a Hcpcs codes. So here the procedure code on UB4 claim form is known as a Hcpcs codes. These codes are associated with the revenue codes instead of place of services. But here, by seeing this revenue code, we can identify what kind of service and where the service is given, where the on which room the service is given to the patient. So by seeing revenue codes, we can understand what kind of service is given and where the service is given. So on CMS 1500 claim form also, by seeing place of services, we can understand that what kind of service is there, that and where the service is given to the patient. So that is the same meaning here, revenue codes. And now we will discuss what is the exactly meaning of revenue code and what are the examples we will look here in this video, and also we will look for other boxes too. Okay guys, here revenue codes we can see on field locator 42 or farm locator 42 on UB4 claim form. On 42 box we can see the revenue code on UB4 claim form. The revenue codes are nothing but these are 3 or 4 digit standardized numeric code used to indicate or categorize the what type of service or procedure provided by the doctor to a patient in a hospital. So this is meaning is that we have a 3 or 4 digit codes on box number 42 are called as revenue codes. These are the numeric codes. These codes are used to identify or categorize that what type of service is given by the doctor to the patient in a hospital. So by seeing this code, we can easily understand that these are this kind of services. So generally this will be identified by the numeric code. So this numeric code will be entered and submitted to the insurance company, so that insurance company also understand that this kind of service is given by the doctor in that particular area or in that particular room example. So in that way it will be used to identify the category of the service whatever given by the doctor to the patient in a hospital. So example I given like room and board, lab test, radiology. So for example services, radiology services is given in a radiology room or radiology block, then we have to use one kind of code. So insurance will understand that the service is given radiology services in a radiology block. So that kind of understanding is done by the insurance, so that we will get a payments by applying the valid revenue codes on box number 42. These revenue codes are used along with the procedure codes. By using the right code for each service, the insurance company can easily see what they are being billed for. So that is we already discussed, right? By seeing revenue numeric code, the insurance will understand exactly what kind of services are billed, and also they will pay the payments, I mean they will give the benefits to the doctor accordingly. So if you are a entered invalid revenue code, for example service is done in a lab test room, instead of using lab test numeric code, if you are a billed to the insurance about some other emergency room code, then insurance identify that your medical records or your services, your procedure code is telling about lab, but the service done in a emergency room. So that insurance will not understand, insurance will thought that the build code is totally incorrect or inconsistent with the room, I mean area where the service is given, and also the procedure. So in that way insurance will not give the payments if you are a billing incorrect revenue codes which are not necessary, I mean which are not valid to the procedure codes. So that is what it is very important, we have to bill valid revenue codes based on the services whatever given by the doctor to the patient. Okay guys, now we will discuss about few examples of revenue codes on medical UB4 claim form. Before that guys, if you are watching our video first time, if you not yet subscribed, could you please subscribe our channel PKR Vibes Career and Growth, and hit the bell icon so that you will get our video as a notifications to your mobile or your desktop. Okay, here I given example one as a revenue code 0100. So this revenue code is telling to the insurance that the services done in the, I mean charges are billed to the insurance, telling to the insurance that this charges for staying in the hospital room. So if the patient is staying in a room and is taking a services from the doctor or doctor nurses, so at the time the whatever the charges done including the room charges, then we have to we have to enter this 0100 code on UB4 claim form on form locator 420100, so that insurance will understand that yes, these are the room charges for staying in the hospital. If the services also valid to that revenue code, then we will get the revenue from the insurance companies to the doctors. Okay, here I given revenue code example 2 as a 0360. So this revenue code is telling about the charges for using the operating room. For example, any surgery was done. For example, there is a day some surgery was done in a surgery room, that is known as a operating room. So the surgery was performed or rendered by the doctors to the patient or by the doctor to the patient. That room is known as a operating room or performing room or rendering room. So the charges whatever applied during the operation done in that operating room, that will be billed as a revenue code with the code of 0360 to the insurance company, so that insurance company will understand if the medical procedures related to this revenue codes, then insurance will give the revenue to the doctor, or insurance will give the benefits to the doctor. Okay guys, now we are discussing about revenue code example 3 0450. This is telling about general emergency room. For example, patient is admitted as a emergency in a emergency room, then general emergency ward or room will be having some kind of screenings or some kind of information they should have to note it. And about the, for example, accident is done, then there should be noted the points where it was done and how much damage is done. So in that way there are some kind of services are done in a general emergency room, and that room charges including the services whatever provided by the emergency department to the patient will be entered as a numeric code 0450 on a form locator 42, so that insurance will understand that these are the emergency services. And by seeing this revenue code should be appropriate to the medical services whatever done, I mean whatever given by the doctor. So by seeing this revenue code, insurance will give the revenue or benefits or payments to the doctors accordingly if we are having valid revenue codes. Okay guys, now we are discussing about revenue code example 4. This is last example I am telling, otherwise video will be become very lengthy. So we have to understand that these are the 0490 is the numeric code. This revenue code is telling about ambulatory surgical center. Nothing but here we have to understand what is mean by ambulatory. I would like to explain. Just ambulatory is nothing. Ambulatory services is nothing but the services which is taken by the, or the surgery which is taken by the doctors within a day. Nothing but the patient is not admitted into a hospital. So nothing but that patient is not staying in a hospital more than 24 hours. So hospital is, the patient is not in become like a hospitalized. So nothing but patient is not admitted as a inpatient to the hospital, but he was taken or he was done his surgery in a day itself. So example, there are a colonoscopy or endoscopy or gastro related surgeries. These services doesn't require to admit into the hospital, just they will consult as per their uh, doctor suggestions, and they will take, I mean they will take the surgeries, and I mean doctor will perform the surgeries and they will come to home within day itself. So these are called as a ambulatory surgical centers. Simply we have to understand that these are a hospitalization services, but it will be not like a inpatient services. It's a outpatient services. Those are called as a ambulatory surgical centers. So if you are a building this ambulatory surgical center, we have to use numeric code 0490. And if this 0490 code is related to the medical procedures whatever done by the doctor to the patient, if it is a valid, the doctor will get the payments or reimbursements from the insurance companies. Okay guys, now we are discussing about field location 43. This is telling about revenue code description. So this is telling about more information like in a description about whatever revenue code we are appending, or whatever revenue code we are entered on a box number 42. That information will give the in a description way in a box number 43. Okay guys, now we are discussing about field location 44 or box 44 or form locator 44 on UB4 claim form. This is telling about Hcpcs codes, rates, and HIPS code like Hcpcs code. So here generally we have to understand that on CMS 1500 claim form we are using CPT codes, but on UB4 claim form or CMS 1450 claim form or hospital billing claim form we are using procedure codes as a Hcpcs codes or HCPC codes. So this Hcpcs code stands for Healthcare Common Procedure Coding System, a set of codes used to identify medical procedures, supplies, and services. So just we have to understand that here instead of CPT codes we are using Hcpcs codes, and CMS 1500 claim for the CPT codes are associated with their respective place of services codes, POS codes. But on UB4 claim form, the respective Hcpcs are associated with respective revenue codes. We have to note this point. And this Hcpcs codes are two type of codes. Like level 1 codes are nothing but 5 digit numeric codes. Level 1 Hcpcs codes are 5 digit numeric codes only. Example I given 45380. These are the 5 numeric digit codes. This is known as a Hcpcs code. It is, we have to understand that it is also like similar to CPT codes, but it is not the CPT codes because we are using these codes on a UB4 clean form simply. And the second one is HCPCS level 2 codes are nothing but the format is alpha numeric codes, since they consist of an alpha letter followed by a 4 numeric digits. Nothing but example I given Z as in Juliet 3380. J3380 is the HCPCS code which is having one alphanumeric letter which is followed by a 4 numeric digits. So this is the format of procedure codes on UB4 claim form. We have to note this point. Okay guys, the field location 45 on UB4 claim form is telling about service date. Nothing but on which date the service was given by the doctor to the patient, that will be entered on a box number 45 on UB4 claim form. And now we are discussing about field location 46 on UB4 claim form. It is telling about service units. So we have to enter the actual number of times a single procedure or item was performed or provided by the doctor to the patient for the specific date of service. For example, I'm taking like injection codes. So in the picture I given like injection codes, nothing but J codes. J codes are nothing but, for example, J3380. That drug injection is given by the doctor to the patient as per requirement in a dosage wise. Like one injection is given after 10 minutes. If it is required, a second injection is given. So after some durations, interval of different times, different, I mean multiple units will be given to the patient. At the time the units will be like 10 units, 20 units, 30 units, depend on uh, severity of that problem. So yeah, we are using multiple times. The procedure is done by multiple times by the doctors in a same day or in a particular date of services range. For example, we are entered multiple date of service range, so that will be entered on a box number 46. So that units, number of units will be entered as a on a, I mean entered on a 46 box on a UB4 claim form. Okay guys, your field location 47 is telling about total charges billed for the services. So whatever the uh, doctor performed the services to the patient, that complete whatever the charges including room charges, service charges, and some other related charges, everything will be calculated and entered on a this box number 47 as a total charges. So we have to understand that, just we have to notate the point that on box number 47 on UB4 claim form telling about total billed amount on that particular medical claim to the insurance companies. Okay guys, now we are discussing about field location 48 on UB4 claim form. These are telling about non-covered charges. For example, there are some charges which are not covered by the patient, or sometimes it is not covered by the insurance, sometimes it is not covered by the doctor as per policy, but they should have to enter on a medical claim form, especially for hospital claims. Why? Because the charges even for covered and non-covered should be entered on hospital claims. Why? Because patient is hospitalized mostly. For example, for outpatient, non-covered charges should be like it's like $0 mostly. This box having 0.00 cents entered. Why? Because for outpatients. If you are going for inpatient, this non-covered charges also should be entered on box number 48, so that insurance will understand that okay, this kind of services are given. So based on this non-covered charges, some covered charges will get high payments. So here we have to give additional description to the insurance that we are performed this necessary services. Because of that non covered charges also, why we have to enter, because for performed services medically deemed to this non-covered services. So sometimes we have to enter the non-covered charges also on a medical claim form to get the complete, I mean high reimbursements for the covered charges. So example, cosmetic services not covered by the insurance. If that services is required to get more payments for the covered services medically, at the time we should have to enter that charges on a box number 48. Simply you have to understand that on box number 48 we have to enter the non-covered charges amount. Okay guys, your field location 49 on UB4 claim form is a blank. It is a future use. Mostly nothing will be entered in this box number 49. So just it will be given as a future use. Okay guys, in this slide I given this picture. Why? Because on overview today we are discussed about revenue code and what are the revenue code description. On box number 43 we can see description, I mean box number 42 revenue code. Coming to box number 44, it's about medical procedures whatever we build like Hcpcs codes. So in box number 45, date of service or service date we can see on a UB4 claim form. And box number 46 we can see on UB4 claim form as a service units, how many units performed by the doctor on a day. Example, that service units are entered that particular date of services on box number 46. And box number 47, what are the total charges, I mean what about the billed amount for that medical claim form, I mean of UB4 claim form, will be seen on this box number 47. And your box number 48 is telling about non-covered charges amounts. And your box number 49 is telling about blank. So this is a overview of this video. Guys, if you felt content is useful, like our video, kindly like our video so that it will reach us many more needy people who are looking this kind of content. And if you already subscribed, I'm very thankful to you. If you're not yet, could you please subscribe our channel. And thank you for your time, thank you for watching. And have a good health. Bye for now. And also please note that if you are looking for training on a RCM and denial management, mock calls, and also interview questions and answers, so I am providing training on a medical AR, complete AR denial management in a medical billing with basic fee. If you need training program really, then could you please feel free to let me know at your contact details at email ID whatever I am providing here, so that I will reply back you. And I'm here to help you. I'm here to help you again, I'm telling. So but I'm taking some basic fee. If you need really training on a medical denial management, I am here to help you. And once again, thank you so much for your time. Bye for now.